In this video, we're going to have a look at the medicines reconciliation workflow for doctors. By this, I mean capturing the medication history on admission, continuation of drugs from the medication history for inpatient use, the addition of new drugs during admission, and the prescribing of drugs on discharge. I've logged into PowerChart and I'm looking at the patient list for Ward 7. Wherever possible, remember to select your patients from inpatient lists, and this will ensure that you are in the right inpatient encounter. I'll double click on the patient to open the record. Typically, I'd be presented with the clerking document. And usually I would be filling in most of these sections. But for this demonstration, I'm going to go straight to the home medication section, which for this patient you'll see is currently blank. The first thing I need to do is document the history. I can get to the screen for doing this by either clicking the plus button here, complete history here, or from request and care plans and selecting medication history there. For now, let's select complete the history. You can see no medication history has been documented as yet. If for any reason I'm unable to obtain the information, I can tick here. If the patient has no known home medication, I can tick here. To add home medications, click the Add button and then type the drugs the patient has been taking. In this example, aspirin. Now you can record a medication history even if you don't have the full details about the dose and frequency. You can put as much information or as little as you've got. You can always come back and add details later, or the pharmacist can add to it when they do the admissions reconciliation. If I do know, I should try to select the whole order sentence. In this case, my patient takes aspirin 75 milligrams orally once a day. They also take Ramipril 5 milligrams once a day, and simvastatin 40 milligrams at night. Once I've finished selecting the drugs, click Done, and we can see the documented medication history. Because I was able to select from full order sentences in this example, you can see on the bottom left of the screen there are no missing details. I can now proceed to document the history by clicking the button on the bottom right of the screen. Back in our clerking documentation, you now see that the medication has been added to the home medication section. In the next section, you can see the status of the meds reconciliation. You'll notice it says the meds history is incomplete, and this won't change until completed, signified with a green tick, until the pharmacist has completed admission reconciliation. But this doesn't stop you prescribing these drugs for the patient during this admission. If we now select admission, we see this screen. Here are the medications I documented in my history. If I want to continue these, I simply put a tick in the radio button underneath the continue column. In this example, I'm going to continue the aspirin and the simvastatin. You'll notice again there are no missing details because I already have a full order sentence, and the green circle tells me that these are formulary drugs. At this point, I'm not going to prescribe Ramipril. Perhaps my patient has acute kidney injury. I should leave these fields blank for the time being, unless I am completely sure that I want to stop this medication and will not be restarting it. And at this point in time, I'm not sure about that, so I'll leave it blank. I now reconcile and sign my order. And we see that in the scheduled medications, we now have aspirin and simvastatin. Now, I also want to add some new medication for this patient. And to do that, I'm going to go to Request and Care Plans. And I'm going to search for paracetamol. My patient's got some pain. I'm going to choose 1 gram 4 times a day orally. And I'm also going to prescribe some VTE prophylaxis. Maybe you had already done this as part of your VTE assessment, but this is an alternative way. If I search for VTE, I'll see a care set here for VTE prophylaxis. Expand this box, we can see what the Trust has available for VTE prophylaxis. For this patient, I'm going to have some anti-embolic stockings, and I'm also going to prescribe dalteparin. And I need to be careful to make sure I select the right dose for their weight. This patient, for example, 70 kilos, I need to select dalteparin 5,000 units once in the evening. When I'm happy, I select OK. I don't need to order anything else at the moment. And again, because I was able to select from order sentences, there are no missing details, and I can sign this prescription. If we go back to my workflow, click refresh, move to the medication section. You can now see the medication we've prescribed. The TED stockings won't show as a medication, but they will have generated a task in the nursing workflow to be fitted and checked regularly. Now finally, the time has come to discharge a patient, and I need to think about a medication for discharge. I can select discharge for the medication tab here, but it's more likely, if I'm thinking about discharge, that I will be in the discharge summary. I access that from the depart icon. And you'll see there's a section for discharge medication. It's not in yellow, which means it's not mandatory, because not every single patient leaving the trust will need medication. To get in, I need to click on the pencil icon, and I'm back in this view. The first thing to notice is that some drugs appear to be here twice, for example aspirin. That's because we documented it as a home medication and then we ordered it. If I want this to continue as a TTO, then I should put a tick under the column headed with the pill box. And I should put the tick against the ordered aspirin rather than the documented, like so. Similarly, I want to continue the simvastatin. I could select the red square here, but it would be better to right click and click Cancel, Discontinue. I will now be prompted for a reason. Select whichever one seems the most appropriate. I could put some further text here. Okay. Now the dalteparin, I don't want that continued, so I can leave that blank. I don't need to stop it. It won't appear on the discharge medication list. But the paracetamol, I would like the patient to have some paracetamol to go home with. Okay. And finally, I'd like to add a new medication. I'm going to start them on some amlodipine. 5 milligrams once a day. Okay. So I've now finished selecting my drugs, but as indicated by the blue cross, I've got some missing details to fill in. So for the amlodipine, do I want the GP to continue it? I'll say yes, as per special instructions. Was it an admission medication? No. Special instructions. Okay. The indication, hypertension. We'll now see that there's no missing details for the amlodipine prescription. For aspirin, I just need to indicate whether I want the GP to continue it, whether it was an admission medication. Similarly for simvastatin. And finally for paracetamol. So now we have no missing fields. I can reconcile and sign. And I'll then see this message, basically asking me to confirm if I've finished prescribing, in which case the majority of the time I will need to send it to pharmacy by clicking this box here. Alternatives, if I'm prescribing a TTO pack to be dispensed by the nurses or midwives, I would tick here. Or if this is a prescription to be dispensed in the emergency department, here. If I've not completed it yet, I can simply say OK. And just to show you what that now looks like on the discharge summary, we have admission medications that were stopped. So that's the Ramipril. We have admission medication that remains unchanged, and we want the GP to continue that. We have new medication prescribed since admission, the indication and any special instructions, and also the paracetamol. So it's very clear to the GP, if we use this system properly, exactly what changes have been made, why, and what needs to be continued. Exit the discharge summary, close, and we're back in our clinician workflow.